We have a non-inferiority study approved for 120 patients. We're very excited about eventually getting it started and getting it off the ground. And we hope that we'll be rolling it out here in the first quarter of this year.
What are your inclusion factors you're looking for?
And we made this study a little bit different in the fact that it's a healing study. We're looking at, do we impact anything related to healing? So we will use a core laboratory that evaluates the healing from a radiographic point of view. The study will be 120 patients and will allow up to 1 to 2 comorbidities. So the study is going to be ankle fracture, but you take a patient who is diabetic and elderly and very susceptible to ankle fractures, that is relative to clinical practice today. These are patients who are going to represent the clinical practice. And we're approved for 10 centers.
Paul, with the 510, once you've got it approved for the screws, could the process then be applied to other implants, or would you require additional studies like a pacemaker or rods, femur rod or something like that? Nail.
So we did this years ago when St. Jude was still a company before they were acquired by Abbott. And I can fully disclose that we did a lot of work on not just the antimicrobial component of coating a pacemaker or defibrillator, but we were working with intact electronics. So they would send us a pacemaker or a defibrillator directly off the line. And then we would then coat the product. Well, now you have intact electronics inside of it, so you have to make sure that you don't cook the electronics during that process. So our process is we can control the temperature on that. Number 2 is, in the case of a defibrillator, when it discharges, it completes the circuit by coming back to the can. Well, again, you have to not insulate the can. So we had to develop some novel striping methods to make sure that the can was still electrically active, and yet it worked quite well. And like I said, we can do it as the last step in the process.